This conference will now be recorded.
Okay, just a minute. Okay, today's topic is pleomorphic adenoma. So, pleomorphic adenoma is a salivary gland tumor. It's a salivary gland tumor, and it is the most common salivary gland tumor among benign and malignant. And among benign, it's the most common. Okay, so this pleomorphic adenoma is also known as a benign mixed tumor. So it's a mixed tumor, and we'll know why it is. And it's called pleomorphic, means it has a varied histological patterns. Okay, so both epithelial pattern and mesenchymal component are both are included in the this tumor, and hence it is called a pleomorphic. Okay, and it is a benign mixed tumor. Okay, so it is the most common neoplasm of the salivary gland. It accounts around 65 to 80% in the parotid gland, and it present in the 10% of the submandibular glands, and the remaining percentage in the minor salivary glands, okay, including sublingual glands. The most important thing is in the salivary gland tumors are whenever, so as the size of the tumor is inversely proportional to the malignancy. For example, if the size of the tumor is small, then if the size of the tumor is large, then it is more likely to be benign in nature. If the size of the tumor is very small, then it is malignant. So this is more commonly seen in the salivary gland tumors. So in parotid or in submandibular or any salivary glands, the malignancy, the either it is a benign or malignant, depends upon the size of the tumor. Okay, and these pleomorphic adenomas are usually occur in the adults in the 4th and 5th decade with a slight female predominance. Okay, clinically, these tumors presents as a slow growing painless mass and is usually between 2 to 5 centimeters in diameter. Okay, and the most important thing both in gross and clinically is these tumors are well circumscribed and encapsulated, but the capsule around the tumor is not present, is not distributed uniformly. For example, especially in the palate region, okay, there won't be any capsule. So at the time of surgery, at the time of excision of these pleomorphic adenomas, if there are any remnant tissue within the palate region, then the chances of reoccurrences is more. And sometimes in, for example around 5 to 10 years it takes, it may be converted into the malignancy. Okay, so the malignant variant of pleomorphic adenoma is carcinoma x pleomorphic adenoma. This is the malignancy, this is the malignant variant of pleomorphic adenoma. Okay, so it's generally it is very rare. So in some locations the capsule is not fully developed, and expansile growth produces protrusions into the surrounding glands, and which may lead to the reoccurrences. Okay, so this is very important both grossly and clinically. Okay, the cut surface reveals rubbery myxoid tan white mass. So we already discussed that the pleomorphic adenoma is a mixed tumor, right? So mixed tumor means it consists of both epithelial and mesenchymal component. So because of mesenchymal component, the cut surface is myxoid in nature. Or when we do a fine needle aspiration, so we used to get the gray white mucoid material because of this mucoid consistency. Okay, presence of mucoid tissue. So this is a gross picture of the pleomorphic adenoma. So this is the tumor component. So generally they are well circumscribed tumors and they have a capsule, but sometimes the capsule is not fully developed, especially in the palate region. So, and the cut surface is gray white in nature, and sometimes it is myxoid or sometimes it is blue in color, depends upon the mesenchymal tissue that is present. Okay, so coming to the microscopy. So as the name suggests, it is highly variable. but always shows an intimate admixture of epithelial and mesenchymal component. So the this tumor arises from salivary gland ducts. Okay, so the salivary glands or the gland ducts consists of two types of tissues, two types of epithelium, right? So inner epithelium, inner luminal side, there is a columnar or cuboidal epithelium, or sometimes a flat epithelium, and the surrounding these there is a myoepithelium. There, these tumors arises from salivary gland duct. Therefore, these tumor consists of both epithelial and myoepithelial component, and the mesenchymal component arises from the myoepithelium. Okay, so this epithelial component consists of ductal structures with an associated myoepithelial layer. So this epithelial component has a ducts which are surrounded by myoepithelium, or sometimes the myoepithelial cells are present individually, means without any uh, means duct structures. So these myoepithelial cells are present individually and they are arranged in the form of irregular tubules, strands, or sheets of cells. Okay, so these myoepithelial cells may be a spindle, clear, plasmacytoid, or basaloid. So spindle shaped cells and plasmacytoid means so the cells are large and they consist of eccentrically placed nucleus. So that is a plasmacytoid appearance. And these are arranged in ducts, acini, irregular tubules, strands, or sheets of cells. So the material that is found in the lumina of duct-like structures is PS positive epithelial mucin. Okay, and there could be a focal areas of squamous metaplasia and keratinization may be present. And these epithelial components, so the epithelial components, that is a cuboidal or columnar cells, they could be stained with cytokeratin, epithelial membrane antigen, that is EMA, and carcinoembryonic antigen. Okay, and the myoepithelial cells are can be stained with actin, vimentin, and S100 antibodies. Okay, this is a smooth muscle actin, SMA, S100, and vimentin. So these are the myoepithelial and epithelial markers. And the second component is mesenchymal or stromal component. So it is made up of mainly a myxoid. That is, myxoid means myxoid material. Myxoid material is mainly consists of hyaluronic acid or chondroitin sulfate. So therefore, this myxoid tissue appears blue, and hyaline means it's pale eosinophilic cytoplasm. Pale, it's like a eosinophilic in nature, or chondroid means presence of cartilage, or sometimes you can also see a bone, osteoid. Okay, and these can be stained with S100. So this is the normal parotid gland showing serous acini. Okay, and these are the ducts. So this is a normal histology. So the normal histology shows these are the acini, salivary gland acini, and these are the ducts. And in between, admixed with adipose tissue. And this is a submandibular gland, consists of both serous and mucinous acini. So these are the serous and this is the mucinous components. Okay, and this is a sublingual gland, consists predominantly mucinous acini and ducts. So this is the duct showing a columnar to low cuboidal or cuboidal to low columnar type of epithelium, and showing these are the myoepithelial cells. Okay, so coming to the pleomorphic adenoma. So pleomorphic adenoma, this is the low power picture and this is a high power picture. The one on the left side shows these are the mesenchymal component, the blue one, the blue tinge. This one, this is the myxoid areas, and this is the chondroid area. So we'll look at it in the high power. So this is the myxoid area and this is the chondroid. These are the both mesenchymal component, and the thing that is present in between this mesenchymal component is the epithelial component. Okay, so these are the ducts and these are the myoepithelial cells arranged in sheets and clusters, right? This one. Okay, this is the high power showing the ducts. Okay, these are the high power and this is the mesenchymal component. So this is the recurrent pleomorphic adenoma. So this is called buckshot pattern. Okay, so generally, if there is incomplete existence of the pleomorphic adenoma, these pleomorphic adenoma can reoccur. So at the time of reoccurrence, they mainly shows this chondroid tumors. Okay, chondroid. This is a chondroid. This is a cartilage. So which are arranged in balls. This is called buckshot pattern. Okay. So pleomorphic adenomas can be divided into three types. So based upon the elements, predominance of the elements, that is either mesenchymal or epithelial component. If the mesenchymal component is greater than 80%, it is called myxoid type, and the epithelial type and the epithelial component is more than 80%, then it is called cellular type. If they are equal, then it is called a mixed or classic type. But these histological types, that is either myxoid, cellular, or mixed or classic type, doesn't have any clinical significance. Okay, doesn't have any clinical significance. And coming to the genetics, these tumors shows a fusion genes of BLAG1 and HMG A2 fusion genes. So generally this fusion results in increased cell growth and divisions. Okay, so this is the microscopic pictures of our slides from the student lab. Okay, so this is the pleomorphic adenoma, low power, the one on the left side, and the one on the right side is a high power. So this is a well circumscribed lesion. So you can see is means capsule. Okay, this is a capsule, and this is the low power. These are the myxoid areas. The one in the this is the myxoid areas. Okay, and these are the epithelial components. So this is the high power showing myxoid area. So this myxoid area, you can see some like blue tinge, right? So this one is the myxoid area, and this is the myxoid area. So myxoid areas means these are the things which are arising from mesenchymal component. So these myxoid areas predominantly consist of hyaluronic acid, and in addition, it may also consist chondroitin sulfate. Okay. So these are the myxoid areas, and these are the epithelial components, the one on the left side. Okay, and this is the well, since these are well circumscribed, this is a capsule. Okay, so this is the another field showing this is the low power again, and this is the high power. Okay, this is a mesenchymal component. So in the this is in the same one in the high power, it shows cartilage. Okay, these are the chondrocytes. Okay, these are the chondrocytes, these small cells. Okay, and which are present within the chondroid material. This is a cartilage. The mesenchymal component is differentiated into the chondroid here. So this is a mesenchymal component, and these are the epithelial cells, epithelial component. Okay, so these are myoepithelial cells. These are spindle to round shaped. Okay, and these are the generally these epithelial components are dispersed or present within the mesenchymal component. Okay, this is the low power and this is the high power. So this is a one more picture showing the center predominantly consists of epithelial component, and this is the periphery. Surrounding this, there is a mesenchymal component, that is a myxoid areas. Okay, this one. So this area, the epithelial component, is consists of ducts. Means this is the one duct. So these are the ducts, and mainly they are arranged in sheets. The tumor cells, the myoepithelial cells, are arranged predominantly in sheets. Okay. So what you have to remember is the pleomorphic adenoma it's a benign tumor and it's a mixed tumor. So it consists of both epithelial and mesenchymal component. Okay, and these tumors arises from salivary gland duct. These ducts consist of both epithelial component and myoepithelial component. Epithelial component consists of cuboidal to columnar cells and myoepithelial cells. The myoepithelial cells are spindle to round shaped. Okay, and the mesenchymal component consists of either myxoid tissue, chondroid, or sometimes osteoid. That is a bony differentiation. Okay, and generally they are well encapsulated, they are well circumscribed and encapsulated. But in some areas, the capsule is not fully developed. So as a result, there could be a chances of reoccurrences in future. So complete excision is the treatment of the choice, is a treatment. So there is, if the surgeon is failed to excise completely, there is a chance of reoccurrences, and the reoccurred pleomorphic adenoma shows buckshot pattern, which I showed you already in the previous slides. Buckshot pattern consists of predominantly chondroid balls, okay, balls of the chondroid material present within the soft tissue. So this is called recurrent pleomorphic adenoma. So the long-standing recurrent pleomorphic adenomas are converted into the malignant ones, that is carcinoma X pleomorphic adenoma. Okay, so these are the pictures from the student lab, and these are the textbook pictures. Okay, so once again, I want to tell you again, this one is the myxoid material. Okay, the one in the blue color is the myxoid. This one is the, that is a mesenchymal component. So this area shows myxoid areas. So sometimes there could be a chondroid cartilage. Okay, so this is the epithelial component. This epithelial component consists of epithelial cells. These cells are cuboidal or low columnar in shape. Okay, so these are the cuboidal epithelium which arranged in ducts. Okay, they could be arranged in SNR pattern, or they could be arranged in strands. Okay, and these are the epithelial cells, myopithelial cells. So if you have any doubt, do you have any doubts? So this is about the pleomorphic adenoma. So mostly you'll get the slide only. Okay, so they'll keep slides in either in a 4x or in a 10x magnification. So you should recognize the mainly you have to see the mesenchymal component and the epithelial component. So this is the only tumor that shows both entities. So there is a one more variant called monomorphic adenoma. Monomorphic adenoma means, mono means single, morphic means morphology. So this monomorphic adenomas consists of either epithelial or mesenchymal component, but not both. Okay, that's called monomorphic adenoma. Okay, so these are the two adenomas which arises in the salivary glands, that is pleomorphic adenoma and monomorphic adenoma. Pleomorphic adenoma is the most common salivary gland tumor, and it is benign in nature. So the thumb rule in the salivary gland tumors are, as the size increases, it's most likely it is benign. So if the tumors are very small, they are mostly they are malignant. Okay, if you have any doubt, you can ask. Okay, thank you. Do you have any doubt?